Welcome back to 3+U. Every Monday we bring you our 2-for-1 on 3 deal of the week. This morning we are happy to have Dr. Gary Gesualdi from Affordable Botox on the show. We're going to be talking about the benefits of looking better. So good to have you on the show.
Thank you. Good to see you again.
I have to tell you that a lot of people want to think about getting Botox, and yet there's a little bit of a taboo about it. They're afraid it might hurt, perhaps a bad reaction to it.
Right.
What kinds of things do you hear from people when they come to your office?
I think initially safety has always been a big factor for that. I think more and more people are having friends that they know or loved ones have gotten Botox. They realize it's the most common procedure, and somewhere along the line it's like, okay, it must be safe. All these people are still doing it.
Yeah.
So millions and millions of people every year.
What are the primary areas that I guess women and men look to get Botox? Is it right here on your forehead?
If I had to pick one area, yes, it'd be right over here. This sort of intensity that people get. And sure, in the 20s and 30s, they do that and it goes away, but start getting late 30s, early 40s, you start seeing this, and then that kind of intensity will be there, makes it look more intense.
So if you get a Botox injection, do you get one injection? Do you get multiple in one area?
Well, yeah, depending on the areas. Like Jen today, if you just frown, Jen, for a second, we'll be getting injections here, here, and here to get these muscles.
Okay.
If she was getting crow's feet, smile, we'd be injecting along here.
Okay, I'll tell you what we're going to do. We're going to have you smile again, Jen, and we'll get a camera to get a close-up shot of her, because what you're noticing is that your face looks fine, but then all of a sudden you really pay close attention and you get those little furrowed areas.
Exactly.
So you were pointing at Jen's forehead here. Is that right?
Frown, Jen. Yep. And so these little muscle groups, as far as what's going to be injected today, will be this on Jen. If she wanted a crow's feet, smile, Jen. And she's very young, she has a little bit here, and so she would only need very little to get rid of those crow's feet there.
Okay. So how often do you have to then get the injections?
Someone Jen's age will usually last a good, we say 3 to 4 months. She'd be closer to the 4 or 5 months type thing. The younger you are, the longer it will last.
All right.
Typically.
You're actually going to give her an injection then while you're here today.
We can do that, absolutely.
Okay, I'm going to step aside. I'll go ahead and may I take that and give to him? Sure. Okay. My hands aren't clean.
My right hand gal.
All right, here you go, doctor.
Thank you. And I think the question you asked about what's the main concerns, I think it has been the safety for the longest time. But now people, like I said, have realized that it's got to be safety. All these people are doing it everywhere, not just celebrities and people with a lot of money. So now the thing is, does it hurt? Because it looks like it would be painful.
Right.
So we're going to do Jen, because it's a very gentle procedure. It's probably no different. This needle is probably the size that you would get for like a little skin allergy test. Right. Okay. And the procedure is very, very gentle, very little pain. And we'll watch Jen for that. So we'll talk to her as we're doing it, and we'll get a good sense about what this actually feel like for someone who's never had it before. Because it is scary.
Okay. Yeah. Well, I'll be quiet, and I'm going to watch you then do your work.
So Jen's just going to lean back like that a little bit. That's good. I'm going to take one little grab of the muscle. And I grab it like that, because by pinching it, okay, it lessens the pain, plus it makes me absolutely 100% that I'm in the right muscle. You see that? And Jen's doing great. Jen, how do you feel?
I feel fine.
So far, so good?
Yep.
Am I hurting you?
Not at all.
Don't be lying.
Not at all.
And then for our last muscle group right here, got that in there.
So the one vial of syringe, you inject it.
Well, actually, Jen only needed very little. We only had a little bit in here. Jen's very young. She has very little muscle movement. No reason to give her more than she needs. Very, very conservative. Rather have her come back in 2 weeks and say, you know, we need to do a little bit more.
Okay, and that didn't hurt you at all?
No.
And what Jen will get here in a couple of days, okay, just frown real hard again. Okay, these muscles will soften up. And we gave her two, by injecting these muscles here, we'll get a brow lift.
Now, when you have something like this done, do most people go back to work right away?
Oh, they can, yeah. Rob, my office man, will tell you, they come in for it's quick. It's talking about once you've been established and we have a conversation, we talk part of the initial consultation. After that, the treatment takes about 5 minutes.
Now, I would imagine that with the holiday season around the corner, you're getting pretty busy this time of year.
We're getting swamped, yes.
Okay, so what the deal that you're offering today, let me show you first of all where Affordable Botox is. They're right there in East Brainerd on Gun Barrel Road. There's their phone number and their website, affordablebotox.com, if you want to check out more. But what they're offering you is this. It's a $250 value. All you're going to pay is $125, but there are only 20 deals available. So, and this is good for one area.
One area. What we did for Jen, okay, typically costs for the average person about $250.
Okay.
They'll get that deal for $125. Jen actually is young enough that she, even without a special, could probably get it done for less than $200. Many people in their 30s and 40s don't have to pay $250 to get that area done, even without the special.
Okay, so if you want to take advantage of this, you're going to want to go to our website, WRCBTV.com, go on over to the local deals tab, and the sales start. at noon today. Only 20 available, so buy.
It will go fast.
They will go very
they
fast.
Always do. And we're located right between Chili's and Starbucks on Gun Barrel Road.
So go get a cup of coffee when you're through.
Exactly.
Okay, let me ask you this though, in terms of aging, you mentioned that Jen is young. At what age should a person begin to think about getting Botox? I mean, do you get people in their 20s?
Oh, we do, and a lot of times we'll tell them that it's probably not in their best interest to start that young. It isn't totally preventive like people are led to believe.
Okay.
So you really want to have movement and some intensity there, the muscles stay there. If you do this and it moves and goes away and no one's ever said anything about it and you look in the mirror like this and there's no wrinkles or levels of intensity or wrinkles, you don't want to start treating until you have at least some of that there. And that could be anywhere from the early 30s to late 40s before some people see it, depending on their genes.
Very good. Well, thank you so much. I'm glad that it didn't hurt you.
No, not at all.
And glad that you're still smiling.
Right.
All right. Affordable Botox, and congratulations on your wedding.
Thank you very much.
Safe
All excited
travels
about
to
that.
Vermont.
Thank you.
We're back with the answer to what is it next on 3+U.